All protocols observed with the head table, members of the media. Good afternoon, one and all. All protocols observed at the head table. Chairman of the board, Mrs. Valerie Allen Rollins, Chief Operations Officer and Board Director, Director Gittins, members of the media, all members of staff at the SWRHA, as well as the general viewing and listening public. Good afternoon. The reason for this press conference is to indicate that the Southwest Regional Health Authority takes note of and wishes at this time to provide clarification in relation to several statements made during the House of Representatives' private motion to improve the delivery of healthcare services to the people of Trinidad and Tobago on Friday, April 26, 2024. The first item that the SWRHA would like to address relates to comments of the rental of a generator for the autoclave unit. We would like to indicate to the general public that at the SWRHA, there was an environmentally friendly incinerator that is currently non-functional and simply cannot be repaired despite several attempts. This will be elaborated shortly. Indeed, despite several attempts, some costly over several years to repair, it remains non-functional to date. The other legacy incinerator is unable to meet the emission air quality standards, despite repair attempts also. In the circumstances, both incinerators are set for decommissioning and removal, subject to regulatory approvals. The autoclave, therefore, that sterilizes non-sharps biomedical waste requires an electricity supply. Acquiring same from TNTech is in procedural stages. In the interim, and so as to treat with approximately 3/4 of the large quantity of biohazard waste generated on a daily basis, consisting of non-sharps and weighing several tons, a generator has been leased to operate the autoclave. To elaborate further on the details of the incinerator in question, the environmentally friendly one that is, would like to indicate to the public that this was procured, installed, and commissioned in 2013 after going through a tender process that concluded in 2012. The incinerator was obtained through WaterTech, the local agent for same, but was manufactured in France by ATI. The procurement was at a cost of $8,900,946, according to our records from the Finance Department. The incinerator worked smoothly up until July 19, 2016, when it was reported that there was a broken bolt on the automatic loading system. This bolt was replaced. The automatic loader was also damaged. An electrical attempt to fix at that time did not work. The WaterTech was called in for support as they were the local representative at the time. And even though they temporarily fixed a part of this incinerator, the hydraulic pump then subsequently gave problems. And at that point, the system was found that it could not be powered down to reset the system, and basically it locked out anyone from restarting the unit. This, as a reminder, is in 2016. During this time, the WaterTech liaised with the SWRHA and indicated that they were in contact with the overseas manufacturer ATI for remote technical assistance to attempt to remote repair the logic controller of the incinerator. This too was unsuccessful. Additional assistance from SWRHA internal departments of IT and other attempts at remote technical assistance simply all proved to be unsuccessful. So in 2016, the related attempts to repair cost $131,680, and thereafter for each of the following years from 2017 to 2019, there have been engagement to the supplier WaterTech of a further sum of $28,320. Apart from these software and electrical issues that has essentially locked out or immobilized the incinerator, from 2019 onwards, the administration did make a greater concerted effort at a certain capital cost of a further $1,579,100 across 2 fiscal years to really substantially repair the incinerator. So there was additional and significant infrastructural damage as well to the electrical and software damage. And we did stuff like installing ducts, the scrubber tanks, stackers, and other ancillary refurbishment works to attempt to get the incinerator up and running. Despite this investment and overall repair, the equipment still has simply failed to work. Subsequent to this extensive repair of the hardware components, up to March 2023, there was a further attempt after the civil works and refurbishment to attempt to do a final troubleshoot repair that cost a final further $18,600, but to no avail. So therefore, at this time, after 7 years, with a further total cumulative cost of $1,757,700, and noting from August the year prior the advent of the autoclave, and also noting that if even this incinerator was repaired, the risk of future breakdown will be high or not environmentally friendly given the nearby waterfront U-Park that is now in the path of any emissions from this equipment, and which essentially means that it no longer is going to an open airspace. The considered decision was made to decommission the incinerator and not sink any more costs into this equipment. Even from a purely financial consideration alone, the sunk cost to repair relative to the cost of the incinerator at this point is average about 20%. That refers to the cumulative cost to repair above the cost of purchase of the equipment, if we assume that we go at the $8.9 million. And I'm reliably informed that if we have to purchase an incinerator again, it might cost us in these times, 12 years later, about $14 million. So as a general rule, if more than 5% of your purchase price is involved in cumulative rental costs, it is an indicator that the equipment has reached end of life and should ideally be replaced. We are not at this time minded to replace the equipment, which is hence before, that's why we are into the autoclave. To expand further, which the substantive matter of hand is with respect to the details on the generator as the one that is giving the electrical supply to the autoclave. In October 2022, in order to start the said autoclave, a temporary short-term rental of a generator from FT Farfan was done, with the commissioning of the autoclave 1 month after in November 2022. Thereafter, until August 2023, there were strategic plans and engagement with TNTech to determine the permanent electrical supply pathway to this equipment. Exigencies arose with the sole remaining incinerator, and I remind that the one that we just had an update on was deemed to be not feasible to continue to repair. The other legacy incinerator has had protracted problems using older technology with emissions coming to the repeat attention of the EMA, coupled with the need to cease the operations because those emissions were now in the airstream pathway of what is now the waterfront car park. So with no method of waste disposal, and given that sort of stakeholder conditions, the only option was to rent exigently a 200 kilowatt diesel-driven generator with equipment electrical characteristics of 230/400 volts, 3 pH, 4-wire, 60 hertz. This was done on a month-to-month exigent arrangement in lieu of the eventual outright purchase of a generator. And I wish to remind the public that notwithstanding it is equipment, this is to treat with and dispose of biohazardous waste. So this was the exigent issue that we had to deal with. Outright purchase has been pursued since January 2024 and is ongoing over the last couple of months to ensure that funds are secured without compromise to other critical areas of the authority, and therefore this is estimated to be purchased by June 2024. Based on the generator in question that has been referred to, based on our requisition procurement system, it yielded Massey Machinery Limited on the monthly cost from August 2023 to date of $51,000 per month. So in summary, at this point, wish to emphasize that the incinerator, the one that was procured in 2012 and commissioned in 2013, stopped working in 2016, and despite attempts to repair, including significant investment over 7 years at a cost of close to $1.8 million, the incinerator is no longer working, and therefore the decision is made to decommission. And with respect to the autoclave, the exigent need to operate the autoclave, given that the other incinerator was also deemed to no longer be viable to operate and to also cause environmentally unfriendly environment. That too has resulted in the exigent rental, but in lieu of purchase of another generator. If we did not do those actions, as was referenced in the public domain when temporarily autoclave was down, we would have unsightly, unenvironmentally friendly accumulation of biohazardous waste and unsafe. At this point, the SWRHA would also like to address another issue that has been in the public domain recently, that of the outsourced incineration providers. If we understand the biohazardous waste, what happened when we had our sole incinerator working before the autoclave, all waste was simply burnt. 3/4 of the waste tends to be what we call non-sharps waste, and 1/4 of the waste tends to be sharps waste. Non-sharps waste, that is those that are not needles and so forth, you can burn it, incinerate it, or you can use the autoclave. The autoclave heat sterilizes the waste, and then we're able to dispose of it. The remaining 1/4 of the waste, which are sharps and needles, cannot go in the autoclave. That still needs to be incinerated. So at this point, despite having this workaround solution with the autoclave, they will still need to urgently still outsource incineration facility services. So therefore, during the August 2023 startup of the autoclave and shortly thereafter, there were episodes, despite clear directives, of poor segregation of waste, temporary malfunction of equipment, unsightly accumulation that also affected the corporate image of the authority, and the media reports in your archives can bear this out. In this regard, the chronology of procurement and engagement were as follows. Not only for the corporate risk, but more so in order to ensure that we have safe, efficient, and effective disposal of biohazardous waste. Therefore, in August 2023, at the start of the outsourced incineration services, we engaged Piranha International Limited as an emergency purchase to remove 7.038 tons of waste for on or around 2 weeks at a cost of $189,000, followed by $71,400, which brings up total cost of $261,200. This involves sharps, body parts, and non-sharps waste. And a reminder that early on with the autoclave, we had some issues that were internal to management and administration by reference staff. A month into the transition to the autoclave and the stopping of the incinerators from September to November 2023, Sanitec Limited was engaged. And the public may or may not be aware, some of the reasons for the temporary accumulation of waste is that based on the current supervisory management at the time, there were concerns by upper management with respect to segregation of waste. And what we found ourselves is that we had to do an urgent clearing of accumulated waste, which accounted to 44.4 tons of waste at that time, over the period September to November 2023 at a cost of $1,554,999.95 as an emergency purchase, given the accumulation of waste and challenges with the autoclave, and also the temporary staffing challenges to run 3 continuous shifts as we do now. The autoclave currently runs continuously for 24 hours. Back then, based on staffing, plus enhanced security, surveillance, and monitoring of the functions of the autoclave to ensure that the biohazard waste disposal goes without incident. So at this time, given these exigencies that now have a more manageable monthly operating cost, the SWRHA has also proactively engaged in a sustainable tendering process to move away from these month-to-month arrangements or these generally ad hoc arrangements. And because we are actively in procurement, there's little we could see at this time, save and except to say we did go out for open tender. We were unsuccessful, and based on the compliance rules, it allows us thereafter to go selective tendering, so that's an active process. However, I would like to indicate as a general food for thought that based on this discourse, if the incinerator that was bought in 2012 was $8.9 million and estimates to purchase a replacement one is about $14 million, when we have done our arithmetic and we look at the cost to outsource incineration in two parts, one for the body parts and one for the shafts, on average, we may have about 4 to 5 years, I would say 4 to 5 years of the ability to outsource the incineration in lieu of purchasing an equipment which cannot even be housed safely where it is there right now physically, because any complex equipment is at risk of breakdown and has constant monitoring with emissions. So therefore, when you weigh the operating business case analysis cost of purchase versus outsource, when you also weigh the administrative overhead and operational costs, which we experienced temporarily with the autoclave at this time for stability, at least in the foreseeable future, subject to approval by executive and the board and other stakeholders based on our strategic plan, this is the best course of action that the SWRHA has adopted at this time with respect to outsource. The other matter that the SWRHA would like to address is the rental of a generator to service the San Fernando General Hospital new wing. We would like to indicate to the public that as a result of the inoperability of the primary generator, which we attempted to repair but have been unsuccessful for some time, and more recently challenges with the secondary generator which serves the new wing of the hospital, rental of a generator was expeditiously effected initially for a 2-week period as the primary generator. So that what we found is that the two generators were giving us challenges. One for a little while, and the other one that we're depending on stopped working on around November 2023. So what we did is that we had to do emergency rental of a generator, make that the primary while we attempt to fix the secondary. Unfortunately, from November 2023 to date, attempts to repair the secondary generator has been unsuccessful, resulting in repeat extensions of the existing monthly rental arrangement. I wish to indicate to the public that the hospital as a building or infrastructure is not only what we are concerned about, is what the new wing houses. This section of the hospital houses our theater, our emergency department, and our intensive care unit services, where we have intubated and ventilated patients and or patients under anesthetic undergoing surgery. I do not think that there can be a cost ascribed to saving and preserving life in a responsible manner. So the SWRHA, whilst we continue to attempt to repair the secondary new wing generator that I referenced from November to present, what SWRHA has already done, which has not been put in the public domain, is that we have since procured a new generator in that same period. This new generator, based on its size, as far as I'm advised, can only be freighted from overseas. And this is when it is received, it is going to be our primary generator for the new wing. And then thereafter, what we are attempting to repair, once it's repaired, we will get back our 2 generators. So therefore, there is already an offer of award of contract for this service, and it is expected in a few months. Once this primary new generator is installed and commissioned, and until the secondary generator is eventually repaired, the current rental generator arrangement will then cease, but not before. We'd also like to indicate to the public, based on the details of this generator rental, as per the predefined emergency need, as stated, Standby Power Limited was procured for the rental of one 1.5 kilowatt generator with 21 cable lengths by 100 feet at a price of $297,000 per month, which is the rental for the generator and the rental for the cables combined for the periods November 2023 to April 2024, which brings us to a total cumulative cost of $1,188,000. Hospital boilers. In simple essence, we acknowledge same, and the SWRHA, through the strategic thinking of the operations department and the board oversight committees, this is already known to us. What has not been mentioned in the public domain is that yes, the 2 boilers are not working simply because we have since purchased equipment that are boiler independent. What are the boilers' function? They provide heat and steam to essentially sterilize equipment and as well as manage domestic water supply for human consumption that has to be heated. So we have already purchased equipment relatively recently at that, but that has been based on strategic procurement, I would say, over the last 18 months, so that at this time, our sterilization department does not depend on boilers, and so too does our water heaters for showers and other domestic uses. The other aspect that was raised in the public domain was with respect to the oxygen generating machine that, which to indicate to the public, came with the San Fernando Teaching Hospital when it was installed in 2013. With regard to allegations of management decisions and public spending, we'd just like to indicate the facts to the public simply. The machine has been found in the past to have been not utilized properly or not operating consistently for several reasons. We have made several overtures and direct managerial interventions by the current administration to repair the oxymat, but this has unfortunately been stymied by procurement challenges as relates to this specific type and brand of inherited equipment. So this is what came with the hospital, and basically, in summary, it was installed in 2013, commissioned in 2014. The oxymat worked for a couple of years, went down in 2016, and there was a defect. There was eventually, it was down for about 2 to 3 years due to challenges to actually repair, and that was rectified in 2019. And it worked then based on executive recruitment by the board with new office holders and executive leadership to ensure that at least for the last 4 years, we ensured that there was a cost savings of $1.2 million in purchasing gases by the oxymat being functional, engaging relevant persons to repair the oxymat. So therefore, yes, we have been able to, we have found ourselves buying medical gases, but we also want to alert the public that when we purchase gases, I want to remind the public we have 2 sides to this campus. We have the San Fernando Teaching Hospital that has the oxygen generating machine, but we have the older Colonial General Hospital that has no such equipment. And therefore, on that basis, we have and always are buying medical gases to serve that hospital. When this happened in August last year, based on operations, finance, and procurement dexterity, and working well with the supplier, we have been able to offset our contingency costs. When we deal with medical gases, we leave nothing to chance. We always have a contingency cost just in case. This happened last year, and we effected our just in case, so that in terms of the taxpayers' budget, even though the oxygen machine went down, we were able to offset the purchase commitment for the gases for the general hospital and offset it in cost to meet the needs for the teaching hospital, so that there was no net increase in expenditure, at least up until the end of last year. This year, we have factored in that the oxymat is still down and that we are still working to basically replace the oxymat. The last matter that is a bit unfortunate for the Southwest Regional Health Authority to have to ventilate in the public domain as I come towards the end of stating the facts for the purpose of this press conference is what we would want to call industrial relations matters that have been raised. As per our standard protocol, the authority's human resources matters are managed internally. But in this singular instance, we are very constrained to comment publicly. All matters relative to the employee mentioned in Parliament are being addressed in accordance with the SWRHA conduct regulations. It is to be noted that the matter is currently under investigation. It is therefore unfortunate, in the view of the SWRHA, that employee or employees are likely involved in the misrepresenting of information to prominent members of society in breach of their statutory obligations. As part of good corporate governance and legal processes, all procurement transactions and management decisions are subject to our internal audit review processes and, where applicable, regulatory enforcement reporting requirements. The SWRHA therefore remains eternally proud of our operational excellence teams, and I pause to mention that there were the names of 4 employees that were mentioned in the discourse, and the SWRHA, through this CDO, is indicating that we are in full support of those employees doing their statutory duty, which they performed very effectively. That is the official position not only of the SWRHA, but of the Chief Executive Officer. And we will be supporting the employees at this time. So the SWRHA remains eternally proud of our operational excellence teams to provide the environment of care to our clients, staff, and visitors alike, following best management, financial, and procurement practices. I wish to thank the media and the listening public very much for your time and attention to these matters that we believe at the SWRHA are of national interest. Thank you very much.
Dr. Elmo, I wanted to find out, yesterday the opposition leader raised a dispute saying that the spotlight should not only be on Port of Spain, but also in other RHAs. I want to find out from you what you think about that statement, and what are the protocols you have in place with the NICU in San Fernando to prevent any outbreak of babies deaths as we saw in Port of Spain.
Okay, I am just one part, quote was, I'm just one RHA in one system. I agree with the spotlight. Please also shine the positive spotlight on all healthcare workers who have performed diligently during COVID. We have 5,000 plus employees in the SWRHA. We have 40 plus facilities. We manage a budget of $1.2 billion, and we see hundreds of thousands of persons in the encounter for illnesses. So the spotlight that I would like to mention is that we do the best that we can, and I think with the team effort of the entire authority, starting with the leadership of the board of directors, we do very well. No system is perfect. Once we quality monitor, we do corrective actions, and we come to the public in every forum for transparency and accountability, and we take views and points on board for continual process improvement. We are fine. So from that point of view, we are fine. With respect to the NICU, the purpose of this conference, this is being well ventilated and managed at the level of the Ministry of Health and PAHO. I would not like to comment further apart from what was stated in the media release, that at the SWRHA, we do have an infection prevention and control system that manages our risk, and that we do take internal clinical and operational actions anytime we see increase of infections that could be a cause for concern. As stated in the public domain, don't want to overstate, but infections in any ward environment in a hospital is a standard risk. What we're really trying to prevent is the spread of infections from baby to baby due to anything that could be potentially preventable in how we conduct clinical practice. And with that, even with the best of efforts, infections are what they are, but I believe for the SWRHA, the authority does very well. And anybody who has any challenges or concerns, we have several modalities, from the doctors and nurses to bereavement counseling to even through the quality department to air the concerns. And therefore, we have proactively already spoken about that at the management and executive level, and which is what we have stated in the public domain, that we wish to commiserate with all who have lost loved ones, including their young ones, and that we are the SWRHA. We do as best as we can to be as compassionate as we can.
Were there any changes in protocols from 2016 now in terms of procurement of equipment or other sanitization efforts or anything following the 2016?
Yes, there has been a fair amount, and it is not a knee-jerk reaction to just simply what we do. So from 2016 till now, there has been an expansion of the NICU. Basically, we have added more beds. We went from 22 beds to 28 beds with the capacity to go up to 34 beds. We have institutionalized since back then to now, but it is even stronger now, our Infection Prevention and Control Committee. And we do a lot of monitoring, hygiene, training, and sensitization. So for example, not only for NICU, infection prevention control is throughout. Not only for NICU, we have an internal policy now where all our physicians, it's mandatory, particularly for the interns, entry-level, junior staff, it's mandatory for everybody to undergo infection prevention control. We have a visiting policy that circumscribes hand hygiene, and therefore we also have operationally through inadvertently through COVID times, and plus in our strategic procurement, we have procured more ventilators. Yes, yeah. We have procured ventilators, We have determined from our infection prevention control and operational advice that our air conditioning system is HVAC and it's totally sealed, and it's fully integrated. Pay attention to every little nook and cranny, ceiling and roof and sofa. But I want to emphasize the point that despite all of that, healthcare workers in that sort of environment are heroes. You're dealing with babies the size of the palm of your hand, and you're really asking for miracles. Yes, we have the science. Yes, we have the skill. But I want to emphasize to the public, because we also spoke to our staff, they go through a lot. And one of the most sensitive, they always say our society is judged how you treat you're very young and you're very elderly. And we judge ourselves the same way, for want of a better word. So we do not um, compromise with the neonatal intensive care unit, and I can say that all other RHAs do their very best. But this is SWRHA at this point.